Well, they look like drinks, snacks, and candies popular with children, but they have an intoxicating ingredient. A bill to regulate hemp-derived products like Delta 8 in St. Louis County was dropped after several weeks of heated debate. 5 on your side's Laura Barczewski has been following this issue for months, and tonight she's hearing from lawmakers and youth advocates on where this all stands now. Laura?
Well, Mike, county council members and youth advocates both say regulations are still needed, and industry leaders don't disagree. But in St. Louis County, the thing is, they couldn't agree on how it needed to be done, and they'd rather see the state take this on to make those widespread changes instead.
From January 2021 to February 2022, the Food and Drug Administration says National Poison Control Centers received 2,362 exposure cases of Delta 8 cannabinoid products. 41% of those involved pediatric patients. Delta 8 is derived from hemp, which comes from the same cannabis plant as marijuana. Youth advocates at Prevent Ed like Adam McBride have seen this in Missouri kids.
Youth have greater access to intoxicating substances than they ever have before.
Just last year, 4 Sumner High students were hospitalized after buying intoxicating gummies at a convenience store. Because of these statistics, St. Louis County Councilwoman Lisa Clancy felt like she had to do something in the name of public safety.
We've seen young people getting sick by getting their hands on these products and taking them, unfortunately. And I'm a mom. I've got little kids. My kids, the kind of stuff that my kids want to eat in terms of candy, they want to eat candy all the time, but it looks a lot like what these products look like.
Clancy introduced Bill 15 earlier this year. It would have required intoxicating cannabinoid products to be sold inside state-licensed marijuana dispensaries, which would have effectively been a ban.
So many of these products are made outside of the state. They have packaging that is against the rules and regulations for recreational marijuana. They don't require tracing and testing. And so there would have been a lot of hurdles that the distributors and manufacturers of these products would have had to go through. And I don't know that they would have been able to do that.
The council heard hours of testimony on the issue. Business owners said they wanted regulations, but not like this.
We want to continue growing our businesses and creating legacies for our families. This bill will eliminate that completely. Many Missourians have invested everything we have in the hemp industry. But if there are challenges or isolated bad actors in our sector, the Mohemp Trade Association stands as a ready partner with this body to address any issues.
After all of this debate, Clancy ended up dropping Bill 15.
It became very clear to me that we were at a bit of a gridlock over what the details of this policy would look like, particularly around whether or not we should compromise around hemp beverages.
Councilwoman Shalonda Webb prepared a substitute bill to regulate instead.
I wanted to make sure that we took care of age gating, packaging, as I mentioned before, labeling. I want to also make sure that the products was made in the USA, because I looked, based on the feedback given at the committee of the whole, a lot of the bad actors were not from the United States.
Webb says she proposed licensing fees and a tax to pay for regulation. The bill also included strong penalties for violations like fines and losing your license after the 3rd strike. For now, they're going to let the state legislature give it another try.
But if the state does not take it up, we're sitting on the sideline ready to go immediately.
McBride says this whole process, while not fully successful, was still a step forward.
We have a better and clear understanding of what retail owners they would like to see. We have a better understanding of what advocates like us from a public health perspective, and particularly a child or youth perspective, would like to see. So I think there's been a lot of progress.
Is there still an urgency to take care of some of this now?
Well, if you'll allow me, I'll answer that with a question. To say that meet that mother, that father, that caregiver of a youth who accessed these and found their way to making a phone call to a poison control center, or found their way to an urgent care or an emergency room because they had absolutely zero idea what was impacting their child, but their child was not acting well and they weren't acting right, and ask them if time is of the essence.
2 similar bills to the ones proposed in St. Louis County failed during the last Missouri legislative session. Legislators head back to the Capitol in January.